Good afternoon. Welcome to the COVID-19 briefing on our spring 2022 return to campus. I'm Robin Kaler, Associate Chancellor for Public Affairs. Today, we are going to talk about our preparations for getting our campus community back into the SHIELD ecosystem and in-person instruction this semester. We know the Omicron variant and recent changes in CDC guidance have certainly created quite a few questions. So we brought together several of our campus leaders and experts today to try and answer as many of those as we can. As always, we will have an archived version of this ready for you. It will be posted on the covid19.illinois.edu website as soon as we can get that ready. So without any further ado, let me introduce our panel. We have Vice Chancellor for Academic Affairs and Provost Andreas Kangelaris, Vice Chancellor for Student Affairs, Danita Brown-Young, Graduate College Dean, Wojtek Hodgko-Zyko, Deputy Administrator and Epidemiologist at the Champaign-Urbana Public Health District, Awais Vade, and Associate Professor of Epidemiology, Rebecca Smith. Thank you all for joining us. First of all, and let's get started. Andreas, before we begin with questions, would you have any opening comments you'd like to share?
Thank you, Robin, and Happy New Year to everyone. And great thanks to my colleagues, Danita, Wojtek, Becky, and of course, Awais for coming together today to help us answer some of the questions we're hearing most frequently and discuss some of the science and research that has informed our planning for the return. I want to welcome everyone back to the opening of the spring semester, a semester we're all looking forward to, yet at the same time, understanding that the Omicron variant has been an unwelcome reminder that the COVID-19 pandemic is not over in our community and that we must continue to evaluate our responses and to adapt our guidance and policies according to the scientific evidence and the advice of our local, state, and national public health experts. The good news is that vaccinations and boosters remain the strongest and the most effective protections we can offer. Even with the more transmissible Omicron variant, the majority of infections resulting in serious illness are among those who are not vaccinated. So I encourage everyone to take advantage of these free and readily available vaccines and to get a booster shot as soon as you're eligible to do so. As Robin mentioned, Omicron has led to some quickly changing information and guidance over the past few weeks. And we do understand how these changes, especially with many occurring during winter break, can be confusing and frustrating. And that's why we wanted to get together with you and provide you with the latest update. But first of all, let me remind you, a return to in-person instruction is important. Our students have made it abundantly clear that they are looking forward to resuming their in-person learning and engaging with the richness of the educational and social activities and opportunities of a residential research university. And throughout the pandemic, they have also demonstrated that they are flexible, willing, and ready to follow the policies and procedures we ask of them, so that we're able to offer these experiences in a manner that maximizes the safety of all of our students, faculty, and staff, and of course, our local community members. Omicron has not changed our commitment to acting thoughtfully and carefully. It has changed the way we embrace the flexibility we have and how we go about doing it in a manner that benefits everyone. And we believe the plans we have made and the adjustments to our requirements and practices will allow us to move forward with this semester in a manner that prioritizes safety and wellness while delivering the experiences our students expect and deserve. Let me take this opportunity also, Robin, to thank everyone in our university community for the continued patience and for demonstrating the kind of flexibility and compassion that have been so critical to our successful navigation of the pandemic. And with that, I'll turn things back to you, Robin, to get us started. Thank you.
Great, thank you, Andreas. And I should remind the panel that I'll direct questions at one of you, but if anybody else has any thoughts you want to add, please feel free to jump in at any moment, okay? We want to have a good conversation going, and if you have some information to share, we certainly want to make sure we hear it. But Andreas, I will start with you. COVID-19 cases are spiking across the country, so why isn't the university just going fully remote?
Robin, we are thankful and fortunate to be part of a community that has put in place a comprehensive, multi-layered approach to mitigating and managing the challenges of the pandemic. We have successfully dealt with worse COVID-19 phases in the past, and we have learned many lessons, and we put those lessons to good use. Our campus has put into place a number of mitigation strategies to handle the Omicron surge. Vaccination, as I said, offers protection against severe COVID. Close to 94% of our campus community is fully vaccinated. The university system has recently mandated a booster shot for eligible individuals so that our faculty, staff, and students will remain up to date with vaccinations. Our saliva-based testing allows any member of our community to test for free and receive results in a few hours, permitting us to identify outbreaks quickly. We have upgraded ventilation systems throughout campus buildings. And to provide time for everyone returning to campus to get tested, the first week of classes will be held remotely. And we are staying the course, and we are encouraging people to wear masks in all indoor spaces, and even recommending that they use N95s, KN95s, or level 3 surgical masks that are more effective in reducing transmission when they have to. We continue to have wellness support associates monitor compliance across campus. What I'm trying to say here, Robin, is all of these actions, this multi-layer approach, contribute to the safety of our campus community and give us the confidence to look forward to a spring semester of in-person engagement in our research and teaching.
Thank you. That sounds like a very happy thing indeed. I'd like to turn to Awais next and talk a little bit about classrooms. Awais, can you tell us how, if you can, say the risk level of being in a classroom at the University of Illinois versus going to the grocery store?
Sure. So, we have been tracking trends for different organizations, different locations, right from the beginning. And the one thing that we try to look at is high risk locations where the virus is spreading more. And what we have noticed, and we've talked about this a lot last year as well, is that in classroom settings where you are with your own cohorts, where it is much more structured, where it is much more controlled, the risk of transmission is much lower, especially when you are following all the protocols that have been put in place. Masking, universal masking, and not just a few people, but everyone masking and masking correctly. Vaccines for everyone, and we know that the campus community is pretty much almost vaccinated, and a lot of them have also been boosted. A good ventilation system so that the airflow is much better, and people taking care of themselves and their surrounding and the neighbors. So that's what happens in the classroom settings on campus. When you're at a grocery store, or when you're going out, in crowded places, indoors somewhere off campus, you just don't know who's vaccinated. There's a lot of people who are around you whose immune systems may be compromised. They're not wearing a mask properly. They're coughing and sneezing around you. So the risk is much higher when you are in an unknown area where people you just don't know the people. We have also not seen any significant evidence of transmission in a classroom setting happening from a classroom and spreading or causing large outbreaks. So we are very comfortable with what the university has done in terms of making the classrooms as safe as possible.
Great, thank you, Awais. And Becky, what makes high case counts now different from last winter, and what are we doing to try to maximize safety?
That is a very good question. The biggest thing that makes high case counts different now than last semester or last year is that our campus community is now 94% vaccinated, and we are requiring the vaccine and the booster, and a lot of our community is boosted as well. And that provides a level of safety against severe disease and even either more moderate symptoms. We also are repeating from last fall and last spring the re-entry protocol of a negative test, but now we've expanded it to everyone needs a negative test before coming back to campus. And that has added a level of safety. We found that to be very effective in previous semesters. For our large events on campus, anything that's open to the public with more than 200 people, we're requiring vaccination cards and proof of a negative test. And that's going to increase the level of safety there. And we've always had really great mask policies on campus, but now we're increasing that to recommend higher level, better quality masks. And that's going to really increase our safety as well.
And Becky, can you talk a little bit about how Omicron compares to other variants? What do we need to know about Omicron specifically?
So one thing to know about Omicron is that it is spreading very quickly. It is highly infectious, but it does not appear to have as high a probability of severe disease. So you might hear people call that milder. You will still have symptoms in a lot of cases, but the symptoms are less likely to result in hospitalization or in death, which is great news that it's a lot milder.
But again, that is for people who are vaccinated.
Especially for people who are vaccinated and boosted. Omicron is able to evade the immune response from just 2 shots of the vaccine or from prior infection. So it's really important to get all 3 shots of the vaccine.
Great, thank you. And can you talk a little bit about why the university is recommending the N95, KN95 level 3 surgical masks instead of just the cloth ones we've been using?
Sure. So the KN95 or the N95 masks or the level 3 surgical masks, these are what are used in medical settings to provide an extra layer of protection. And they have been found to be important for that extra level of protection with such a highly infectious variant as the Omicron. We are recommending them, but not requiring them. We understand that in some circumstances or for some people, they can be difficult to use. But there are options for making yourself safer with just a better quality mask. If you are going to wear an N95 or KN95, we have training guidelines available on the COVID-19 website that can help you make sure that you're wearing them properly to get the best benefit from them.
Great, thank you. And a waist, do I need to wear N95, KN95, level 3 all the time? Do I need to throw away my cloth masks, or is there still a use for them sometimes?
Right. So
I have a lot of them. I'll just tell you.
Yes. So in my mind, a mask, a good quality mask worn properly and worn consistently is very important. And if you are able to tolerate N95, KN95, and you are able to use it the way it is being recommended to be used, then that's a great option. But again, not everybody is going to be able to tolerate an N95 for long periods of times. And, those have to be replaced when they get, soggy or dirty as well. So the cost has to be kept in mind as well. But if you have a good quality, surgical mask or a 3-layer cloth mask as well, and if you're going to be wearing it consistently and correctly, then those do have good benefits as well. If you are going to be, in a high risk occupation, if you are around people who are immune compromised, if you are yourself immune compromised, then you need much higher protection. And in those cases, N95, KN95, a grade 3 surgical mask would be a better option.
Great, that makes much more sense. Thank you. Andreas and maybe Wojtek could add some thoughts here too. What happens if instructors, and including teaching assistants, get sick or someone in their family gets sick and they simply can't teach in person?
Robin, thank you for this question. This is a very important thing that I want, first of all, to start answering by reminding everybody that those instructors who cannot teach in person for medical reasons, they should seek a medical accommodation through the Office of Access and Equity. We've done it in the past, and of course, we emphasize that this needs to be done now as well. Now, for those instructors who are teaching in person, we recognize the need for short-term flexibility to deal with unexpected personal circumstances associated with COVID. For instance, if they are or a family member becomes ill, if local schools shift to remote format and so on, where it is necessary to temporarily move a class online for a period of time. And we are going to be very flexible. And in fact, later this week, we will be providing all instructors who are teaching in person specific guidance of how to deal with these unexpected personal circumstances and be ready to engage with their units of how to manage that. And I would like Wojtek to talk a little bit about our graduate students as well, because not only do they become part of our teaching enterprise, but also because they are involved in research and they and their advisors have things to share when it comes to challenges with COVID. Wojtek?
Yeah. Thank you, Andreas. So, I know that we've been receiving questions from graduate students about their research obligations and thoughts about their assistantship assignments. And I think the number one priority is the safety of the community. We recognize that many graduate students are caregivers and their children sometimes will be quarantined and they will have to stay home to look after them. We understand that people will test positive and need to stay home. I think the number one thing you should do is reach out to your department and your advisor to discuss how you can, on a short-term basis, adjust your research and assistantship assignments so that you can stay home for isolation, quarantine, and caregiving and get back to the community as quickly as possible.
And Robin, I would like to take this opportunity to also ask our instructors to please be as accommodating as possible for students who indicate that they must miss class for COVID-related reasons. We encourage instructors to handle student absences as they would normally, to allow the affected student to maintain progress in the course, providing alternative assignments, access to recorded sessions, access to notes, and so on. We need to be flexible. And the last thing I want to say is for our students, our instructors, our graduate students, if you feel sick, please do not go to work. Do not go to class. Take your time to recover. This is the best way to look after your well-being, your family's well-being, and everyone else's well-being.
Well said, thank you. And I know we probably are sounding like a broken record. I don't think there's a whole lot new we've said today, and there may not be a whole lot new we say the whole time, but we're going to repeat. Get vaccinated if you aren't, get boosted if you aren't, and stay current on all of those if you can. So Becky, can you talk a little bit about the effectiveness of boosters? I know I've got some friends who say, well, I got the 2 shots and I feel like I'm pretty good now.
Right. And the first 2 shots were incredibly effective against earlier variants of the virus, but Omicron has found an ability to get around the protection provided by the first 2 shots. And we've also seen that their effectiveness wanes over time. So we see the effectiveness going down over time. So the CDC now recommends that people who have finished Pfizer or Moderna series 5 months earlier, or Johnson & Johnson vaccine 2 months earlier, receive that booster to increase that immunity and to protect themselves against this new variant especially.
Great. Waste, anything to add there?
No, I think Becky has covered pretty much what I would say as well.
Then let's move along. And Waste, one thing that we have heard throughout COVID is about young males sometimes getting myocarditis after receiving COVID vaccines and now the booster. Can you talk a little bit about that?
Yeah, the one thing that I would want to say, I mean, if it was me and if I was a young male, then I would be more worried about getting myocarditis after contracting COVID. So that the risk of getting myocarditis after an actual infection is so much higher. And after we have administered millions of boosters and primary series to young men, and the number of people who've got myocarditis after getting the vaccine are a handful of people that we have reported evidence of, and most of them, if not all of them, most of them have been treated by their providers, and they have recovered fully as well. But again, like I said, the risk of myocarditis after getting COVID is much higher. So I would recommend that people who are thinking of not getting the vaccine or the booster because of myocarditis risk should be actually getting it, because that reduces the risk of myocarditis.
Great, thank you. I appreciate that explanation. And Danita, now that boosters are required for faculty, staff, and students, can you talk a little bit about where especially students can get their boosters and how they need to upload it, or if they need to upload it to My McKinley, that sort of thing?
Absolutely, Robin, and Happy New Year. Well, we plan to provide time for everyone to receive their booster when they are eligible to meet that new requirement. And I know that there may be questions about eligibility, so we encourage individuals to check the CDC guidelines before scheduling their appointment. We will also provide more information to individuals after the spring 2022 semester begins. But it's important to know that if you have already received a COVID-19 booster, we thank you for doing your part to protect yourself and those around you. If you have not received a COVID-19 vaccine booster and are eligible, we strongly encourage you to receive a booster before you return to campus if you are able. You can find appointments at pharmacies in your local area on vaccines.gov. If you are a student and are not able to receive a booster before you return to campus, you can make an appointment in the My McKinley portal to receive a booster when you return to campus. Now, here's also some important information. If you received all your doses in the state of Illinois and you already have a verified vaccine record on file, you do not need to upload your booster record to the My McKinley portal at this time. All Illinois-based vaccines should be automatically captured in the McKinley Medicat system within a few weeks of receiving your vaccination. So just be a little bit patient. But if you received any of your COVID-19 vaccine shots, whether that's your first dose, your second dose, or booster outside the state of Illinois, you should upload your record to the My McKinley portal. But the important point is get boosted.
Thank you, Danita. And a way for folks who are not students, but still in the community and want to get the shot, vaccines.gov works for everyone, right?
Yes, vaccines.gov work for everyone, and many appointments are available throughout the community, including at Public Health 5 days a week.
Wonderful, thank you. Andres, why did the university switch from requiring 2 negative tests with 1 off campus for undergraduates to just 1 negative test? There was a little confusion over that, we know. So if you could kind of walk us through that, that would be great. Thanks.
Sure thing. So let me say that we're still strongly encouraging students to take an off-campus FDA-approved test before they return to campus. However, we removed it as a requirement because we heard from many students and parents that it has become incredibly difficult to find tests in their communities, leading to equity issues. And also we heard many testing locations were not able to turn around results in less than 72 hours. We also heard many testing locations were not testing individuals without symptoms. So, sometimes we get spoiled by so much availability and access to free testing on our campus, and we assume that the same thing applies in other communities. Well, that is not the case. And that is the reason why we remove the requirement of an off-campus test before the students come back.
But again, still encouraged, so great.
Still
And if someone tests positive over break or still tests positive over break, can you walk through how they go about returning to campus with their process?
Yes, this is a very important point, Robin. Thank you for this question. The university needs the individual's positive off-campus results to speed the processing of any repeat positives once they return to campus. Students, faculty, staff who test positive for COVID-19 at an off-campus location should submit their positive off-campus COVID-19 test result through the My McKinley portal. And please submit your positive results well ahead of the beginning of the spring semester to ensure a smooth transition back to campus.
Great, thank you. So always throughout the pandemic, a lot of us have used positive cases as the kind of indicator of safety risk in our community. But with variants like Omicron and now with vaccines and booster protection, what are the important metrics that we ought to look at and who is at risk?
Right. So, Robin, from very early on, our priority has been to make sure that hospitalizations remain the #1 priority for us. We look at hospitalization and hospital trends and number of deaths, weekly, monthly as well, as our benchmark for the most important metrics for any infection, including COVID as well. And so just number of infections by itself are not the only things that we look at, and that might not be the most important metric as well. But when we look at hospital capacity, how our healthcare system is able to manage the patients in the hospital, and then also knowing what kind of individuals are getting infected and who are having the complications and who are dying from those are also the metrics that we look at as well. So that we can, again, the reason for looking at all of these things are so that we can educate the community and do preventive measures to prevent the most vulnerable population in our community from getting hospitalized and dying from COVID.
Great, thank you. That's very, very helpful to know. Becky, at the beginning of the fall 2021 semester, we did have a surge in cases. Are we expecting another surge when students come back now in January?
We have seen a surge in cases at the beginning of every semester since this pandemic began, and we will expect another surge in cases as students come back, especially because we know that their cases are surging across the country and throughout the state of Illinois at the moment. So we will see a surge in cases as students come back, and especially as testing becomes available to them as they come back to town. That said, we can be a little bit more cautious, and we really encourage people to be very cautious over the next few weeks. Avoid those large in-person gatherings, wear those high-quality masks, and as soon as you get back to town, come in and get tested just to check yourself before you start circulating with your friends. Just keep those numbers under control as far as spread once you get back to town. We do know that the surge will come, but we can be cautious about it and keep the secondary spread to a minimum.
That's great. Thank you, Becky. And we have heard, again, we said a lot of things have happened in the past couple of weeks. One of the things we've heard is that IDPH is now, Illinois Department of Public Health, I should say, is now planning to shift approach for contact tracing. Can you explain what's happening and what it means for us, and should we be worried?
Sure. So contact tracing for IDPH or for CUPHD is one of the tools that public health has used for years and for decades to prevent the spread of infection in our community. But again, it's only one of the tools that we have utilized. The state, when we first started with COVID, contact tracing was different. And over the last 2 years, it has evolved and it has changed multiple times. And when the state and the CDC and multiple other states assessed the cost benefit of the way contact tracing was done, now they decided to change. And I think in the short and the long term, the change will be much more beneficial because it will be much more systematic and much more efficient as well. So what's going to happen, and the change already has started to take place already in the last 1 week. What's going to happen is the state will prioritize contact tracing for individuals who are older than 65 and children under the age of 18, especially when they are in schools and daycares. Outside of that, anyone between the ages of 18 and 65 who test positive will be getting an automated text message from the state surge system. And what that message is going to say is that you have tested positive and you should contact this number for your case investigation so that you can be interviewed by a contact tracer. Now, this is an opt-in testing. It's an opt-in system. So you have to opt in, you have to call that number to be interviewed. If you do not call, then you will not be interviewed. I think that is very important. A lot of people will assume that they got this text message, but they'll ignore it. If you ignore that text message and you do not call them back, even after a couple of reminders, you will not be interviewed. And so at the end, if you really need a release to go back to work or to go back to your classroom, if that's what your instructor or your employer is requiring, if you have not completed those interviews and completed the assessment, then you will not be able to get those release letters from the state as well. So two things, important changes. One is that it's going to be an automated system for most individuals, and you will have to complete those if you need releases to go back, if it is required by your employer or your school to go back.
So it does sound like we're shifting to a phase of even more personal responsibility, right? That
Absolutely. I think going forward, with 1,000+ cases in Champaign County in a day, it's almost impossible to be having staff who's calling so many people and, multiple calls to each individual to try to get them. So the burden now is going to be shifting from the agency that is trying to do the case investigation to the individual. So it's going to be individual responsibility. And I think it's also important that once you answer that call, you do give them information about your close contacts. You do give them information about your classrooms or your employer settings, or if you have attended large gatherings. If you do not provide the information, we will not know what's happening, and we will not be able to investigate clusters as well.
that's a really good point. And then again, boost, wear your mask, stay home if you don't feel well. Right?
Absolutely.
Okay, sounds good. And Danita, obviously, even with the change in contact tracing, that doesn't mean we're not going to be doing isolation and quarantine. Can you talk a little bit about the plan for isolation and quarantine for students?
Well, we strongly recommend all residents to test prior to traveling to campus. I'm sure you've heard that a million times, but we cannot stress that enough. There are limited isolation and quarantine spaces available here on our campus. Just have to be really honest and upfront about that. If our students can safely do so, students who test positive prior to arriving on campus will be asked to isolate at their permanent residence. Okay. So students who test positive or are required to quarantine as a close contact after arriving on campus will also be asked to return to their permanent residence to complete their isolation. Now, that's only if they are able to do so safely. Isolation and quarantine space provided by our campus will only be available to those students who cannot safely return to their permanent residence to isolate. So that's a little bit of a change.
It is, yeah. Again, with the scale, it makes sense. So Awais, I know a question we've gotten a lot is, if people who are vaccinated are still getting COVID, why does being vaccinated matter?
One of the things that we saw from Carl, the data that came from Carl just yesterday, I think the most important thing that I got from that is, there's probably about, in the Carl system, more than 200 people who are hospitalized right now as of today. And 26 of them are in the ICU, intensive care unit, some on a heart-lung monitor as well, some children as well. Of those 26, how many are fully vaccinated or up to date on their vaccines? 0. So every single one, 100% of them are either not vaccinated or not up to date on their vaccines. And I think that speaks volumes, right? If you are vaccinated and if you are boosted, your chance of being hospitalized or being in the ICU is drastically reduced. And we have numbers out here locally. And I mean, these are not just numbers, these are people. And these may be people that we know. This could be our friends, our family, our neighbors, whoever. So we know that getting the vaccine keeps us from the hospital, keeps us from the ICU. Why would we not do that?
Amen. Very, very well said. Yeah, really, I mean, when we talked a little bit about personal responsibility, you might think of it as personal protection, right? That it really does. There are things that you can do yourself these days that are real and meaningful.
Right. And I mean, again, I'm not saying that getting the vaccine or the booster is going to prevent you from getting COVID. And we know that that's not the case anymore. I mean, you might still get it. But again, I think the most important thing out here, a learning lesson from me is that if you want to stay out of the ICU or from the hospital or from critical infection or even death, vaccines and boosters, I mean, being up to date on your vaccines, which includes getting the booster, is the most important thing you can do right now for yourself and for your family.
Absolutely. Thank you very, very much. Yeah, I'm not one who likes needles. Every time I go give blood, I always get a little queasy about it. But boy, I always feel like, gee, if I ever was in a position where I needed blood, I'd be so glad other people had given blood. So I think same kind of thing. You just, when you get to that position, you don't want to regret later on. So very, very well said. Thank you. So with that said, we've obviously talked a lot throughout the pandemic about our shield ecosystem and the importance of the scale of testing that we do and the frequency of testing we do. With that said, Becky, and with this spike, why aren't we just requiring mandatory testing for everyone all semester?
And that's a good question. And it's a question that a lot of people have raised. The truth is that regular testing of all fully vaccinated individuals is just less useful than targeted testing. We need to shepherd our resources well, and the resources can best be shepherded into targeted testing. Now, a targeted testing of vaccinated individuals will continue to be necessary. For example, this testing to return. This is a very good use of our time and effort to make sure that people know before they come back to campus whether or not they're safe to circulate. In addition, we'll continue to be identifying locations and units on campus that have increased cases and asking individuals in those areas to test every other day until cases improve. The unvaccinated will be required to test every other day because we know they have an increased risk. And we are asking anybody who's not in the targeted testing, not in the required testing, but who feels that they have been exposed or who has symptoms or is feeling sick, please go ahead and get tested. We have this free resource available on campus. You should take advantage of it. Go get tested if you feel that it is appropriate to do so. And I would recommend, if you feel you've been in a situation that may have exposed you, days 3 and 5 post-exposure, go get tested. If you have symptoms, go get tested. Please just take care of yourself that way.
Great, thank you very much. And we know this thing has been kind of unpredictable. And so, Andreas, what would happen if we have enough of a spike in the community that local schools, for example, K through 12, would go online again? What would that mean for our employees?
Robin, as I already mentioned, we need to be flexible. We need to be flexible with our employees, our faculty, our staff, our graduate employees, and allow them to meet their family care obligations by working remotely for a period of time. And our approach for this upcoming semester is to adjust and accommodate to meet the needs of our faculty, staff, and students whenever possible. I want to emphasize the fact that everything we hear as we discuss with everyone today goes back to something that we know this community is very good at, and that is personal responsibility. And I say this because at the end of the day, we all know that that personal responsibility, each one of us doing the right thing, and each one of us accommodating the needs of others as we go through the Omicron wave, is going to serve us very well. We hear it from Becky, we hear it from Danita, we hear it from Awais. This is what we need to keep in mind. We are a community that is so fortunate to have all these assets in dealing with COVID. And we are also a community that is now trained very well. I mentioned earlier, we have learned our lessons throughout the past 2 years, and we know how to go about looking after the well-being of everyone. Flexibility, willingness to accommodate our people, making sure that everyone is ready and responsive to requests is going to serve us well. And as I mentioned, we'll be sending guidance to all units of how to go about this as they engage with the start of the semester.
Great, thank you. Wojtek, anything you'd like to add for your graduate students specifically?
No, not necessarily. I just wanted to actually say a few words about school children. I have 4 young children, 3 in elementary school and 1 in daycare. And in the last 2 weeks, 3 of them have been sent home at very, very short notice because they've been a close contact. And I just want to make it clear, we understand how stressful this can be for caregivers, whether they're staff or faculty or students. And very often you have to change your plans at the very last minute. But I think everybody at the university understands this, and we have a commitment to being flexible and for allowing everybody to do what they need to do to keep their families safe. And we will adjust, just like the provost just said. And I think we'll get through this.
Or as Danita always says it, would you like to say it, Danita?
We have to give our grace. We have to give grace, and we have to be flexible. We have to make sure that we are giving regular amounts of compassion and empathy to all of our team members. Because I, like Vortek, I have a young daughter who is in preschool. And so, no, we have got to make sure that we are nimble and we're supporting our team members every turn of the way.
And Danita, I know we have many parents listening in today. Again, if a student is sick and not sure where to turn and needs help, where would you recommend they call?
I would recommend they call either the Wellness Answer Center, or they can call the Office of the Dean of Students. Our Student Assistance Center is always there to help. But, we have so many people here that can help answer your questions, or go to the COVID-19 Illinois.edu website. That is always going to be your best bet with the most up-to-date information that you can quickly access it. So I would go to the website first, and if you're still unclear, then contact either Wellness Answer Center or our Office of the Dean of Students.
Okay, great. And can you talk a little bit, I know, again, parents are tuned in, and as are some students. Can you talk a little bit about how we're monitoring compliance with the return testing? I know that's always an important thing for people to know.
Well, we do have a comprehensive digital testing compliance system, and any student who does not receive a negative result before the first day of instruction will be contacted. So I suggest you go and get your test so that you can have a negative result. But students out of compliance may receive student discipline up to and including dismissal. So we are monitoring that. And to clarify, sometimes people get dismissals confused with expulsions. Dismissals are not expulsions. The University of Illinois does not expel students. Dismissals are not permanent, and they really provide that student an opportunity to petition to return to the university during a identified future semester. So we don't expel students, just to be clear.
Great, thank you. And again, our goal is to not ever even get to that stage, right? It's to
No,
really
we don't want you to get to that stage at all. We want people to be in compliance. We want them to, do the testing if they are responsible for doing testing, get boosted, do everything, as Provost Cangelaris has already mentioned, about that personal responsibility to keep our community safe. If we want to have an in-person experience, then everybody's got to do the part.
Absolutely. And again, I know Danita and I especially are working a lot together on mental health for students. And we would say, again, don't wait. If you need help, ask for help, advice, guidance, right, Danita?
Absolutely. Do not be afraid to ask for help. We always talk about a closed mouth does not get fed. And, if you need help, you've got to ask. And your mental health is very important. We focus so much on wellness and well-being, because if your mental health is not intact, if your physical health is not intact, you're not going to be successful. You're not going to be able to do day-to-day activities. So we do pay attention and focus on mental health. There are so many resources available here to help, but don't wait to the last minute, and don't think that you're the only one. Everybody needs help from time to time. So don't be embarrassed or don't be afraid.
Great, thank you. And I should have given out the information when you were talking about where to contact the Wellness Answer Center, 217-333-1900. Again, that's 217-333-1900. Or you can send a question to covidwellness@illinois.edu. So again, COVID wellness, one word, at illinois.edu. So yeah, please do reach out if you have questions or concerns and you need help, because as you can see, this is just a small representation of all of the people who are available to try to help and make your Illinois experience the best it can possibly be. So with that said, I have to compliment you all. I asked you all before we started to be as concise as you could on your questions, because we had so many to get through and I was afraid we couldn't do them all in an hour. and you've actually done them in less than an hour. So Andreas, I'm going to go ahead and let you wrap us up now, but don't feel that you need to take the next 15 minutes unless you are so moved.
Well, Robin, first of all, let me once again wish everyone, all my colleagues here, and everyone who has joined us, a happy new year. We are an amazing community, and that's what we need to remember. As we all said, we have learned so much through the past 2 years. I don't believe there is any other university community that has come together to think through, plan, anticipate, and deal with such a crisis the way Illinois has been able to do it. And I say this because at the end of the day, I'm being reminded of what is our responsibility. Our responsibility as a university is to engage everyone in learning through experiences, through knowledge, through new research, new understanding, and becoming better for the next generation, the generation after that. And so with that, I want to say, I am very optimistic about 2022. If I had the opportunity, I would tell you why 2022 is such a special number. My colleagues who are mathematicians know that 2022 is a very special number, has some very special properties, but I will avoid discussing that, and all that I want to say is thank you all very much. I look forward to engaging everybody back to campus for spring 2022. Be well, and all the best to our students, our faculty, our staff, and their families.
Thank you so much. And thank you again for serving as our host. Chancellor Robert Jones was not able to be with us today. He was called away for another commitment, and he was very grateful for your leadership today and every day. So again, I should say as well, for folks who have additional questions, the covid19.illinois.edu website has a trove of information on it. There's a search function you can go to and type in your specific query. You can just kind of poke around on it and find all kinds of good information. And then again, you can always ask a question in the COVID inbox. So please do reach out if you have any additional questions we didn't cover today. But right now, I'd just like to say thank you again to Andres Cangaleras, Danita Brown-Young, Wojtek Hajko-Zajko, Ovais Vade, and Becky Smith. Also, thanks to Julie Pride at the CU Public Health District 2, who is always there for us. We are so grateful for her. And also thanks to our colleagues in Public Affairs and Tech Services who make this meeting happen. And a very special thank you to Ellen Denny and Daniel Solf, who have provided the live captioning for the briefing today, even if I talk really fast. So thank you both very much. Again, in case you missed it, vaccines, boosters, still free, still available throughout the community. You can find appointments at vaccines.gov. And as Awais said, 5 days a week, you can go to CU Public Health to get a vaccine. We do have 5 testing sites back open on campus in operation every day, 2 more being added next week. You can find those locations and hours at covid19.illinois.edu. And this does conclude today's briefing. Again, give us a couple of days to get things in order. We will, as always, provide the archive of the briefing, and it will be listed out by question. So if you just had a specific question you wanted to go back and listen to again, you can just go right to that with a time code on the video that we'll provide. So watch for that in a couple of days. Get boosted. Did I say that? Get boosted. And have a very safe trip back to campus for those of you who are not here right now. We're so excited to see you come home. We've missed you very much. Happy New Year. Have a great day. Thank you.